What are binaural beats? Binaural beats are auditory hallucinations created when two tones of slightly different frequencies are played separately into each ear. The brain perceives a third tone that is the mathematical difference between the two frequencies. So if you're listening to a sound in your left ear that's at a frequency of 132 Hz and in your right it's 121, your brain will fall into synchrony with the difference, or 11 Hz. So you will only hear this tone as well as the separate tones in each ear. For binaural beats to be effective, they have to have a frequency of less than 1000 Hz, and the difference between the two tones can't be greater than 30 Hz. They are often used for relaxation, meditation, and enhancing focus, as well as pain relief. Scientific evidence on their effectiveness for these purposes are, however, mixed. They were first discovered in the 19th century by a Prussian physicist and meteorologist named Heinrich Wilhelm Duve, but only mechanised in the last few decades for its potential health benefits. So what are the potential health benefits? Binaural beats are claimed to be similar to meditation in inducing the same mental state in the brain, but more rapidly. This is said to occur at frequencies between 1 and 30 Hz. Your brain will synchronize with the frequency it hears and create the brain waves it needs. So what frequencies are used? Common frequencies range from 1 to 30 Hz, with specific frequencies believed to correspond to different mental states. The delta range, or 1 to 4 Hz, invokes deep sleep and relaxation. The theta range, 4 to 8 Hz, is good for REM sleep, decreasing anxiety, relaxation, and creative states. The alpha range of 8 to 13 Hz seems to be best for relaxation, positivity, and decreasing anxiety. The lower beta range, 14 to 30 Hz, increases concentration and alertness, problem solving, and improved memory. I'm getting onto the higher frequencies now, 40 Hz, for enhanced training and learning. Generally, the theta rhythm at roughly 5 Hz has shown the most promise for pain relief, and there are some randomised controlled studies online if you're curious. So how long do I have to listen for, and when will I see results? The frequency and duration of listening to binaural beats can vary depending on individual preference and goals. Some people listen to them for a few minutes as a quick relaxation technique. Others use them for longer sessions during meditation or study sessions. But how long does it take to work? This can vary from person to person. Some people experience noticeable effects within a few minutes of listening, such as increased relaxation or focus, while for others it may take longer to perceive any changes. Factors such as individual sensitivities to sound, the specific frequency used, and the individual state of mind can all influence how quickly someone responds to binaural beats. It is essential to be patient and experiment with different frequencies and listening durations to find out what works best for you. But are there any side effects or dangers to listening to binaural beats? Generally, they are considered safe for most people when used safely and appropriately. However, there are a few considerations. 1. Potential discomfort. Some individuals may find certain frequencies uncomfortable or unsettling to listen to, particularly at higher volumes of frequencies. Number 2. Risk of auditory hallucination. Binaural beats relies on the brain's ability to perceive the difference between the two tones presented separately into each ear. While this generally works well, some people may not experience the intended effects or may perceive the beats differently. Number 3. Seizure risk. There is a theoretical risk that binaural beats could trigger seizures, particularly those sensitive to light or sound stimuli. However, such cases are rare. And number 4, interference with certain activities. Listening to binaural beats can induce relaxation or altered states of consciousness, which may not be suitable when engaging in activities requiring full attention, such as driving or operating machinery. As with any audio-based intervention, it's essential to use binaural beats responsibly, follow recommended guidelines, and consult with a healthcare professional, especially if you have any concerns or history of seizures or other neurological disorders. So do give them a try. You can find audio files or videos on YouTube, and don't forget to wear your headphones for the best effect. Goodbye.